today's episode of She Has a PhD, the podcast where we celebrate extraordinary women in science. I'm Inês Veiga, your host for today. Last week, we had the pleasure of speaking with Sandra Caldeira about her inspiring journey in science and leadership. Today, she's back for a short conversation on her current work in disease prevention and public health policy at the European Commission Joint Research Centre. Welcome back, Sandra.
Thank you, Inês.
So, Sandra, can you tell us a little bit more about the projects that you've been developing lately on the disease prevention units, and what are some of the key initiatives you've been working on?
Yes, I think I told you last week already about the Joint Research Center. So this is the service of the Commission that provides science for policy. So better said, the mission of the JRC really is to provide independent, evidence-based science and knowledge to support EU policies for a positive impact on society. So in that setting, what we, and by we, I mean my unit, so me and the 40 or so wonderful colleagues that work in my corridor, is to support health-related policies, mostly related to non-communicable diseases. So non-communicable diseases are non-infectious diseases, like cancer, like cardiovascular disease, like diabetes, for example. So one big focus of our work has been cancer. This commission has launched the Europe's Beating Cancer Plan. And so for the past 4 years, we've been really working a lot in this area. So we know, for example, that cancer kills more than 1 million people every year in the EU, so in the 27 countries of the European Union. To be more precise, it's 1.3 million deaths, 2.7 million new cases in 2022, for example. So this means like 5 new cases every minute. And how do I know like all these numbers? I know it because it's actually my colleagues that compute this. So it's my unit that collects data from all the EU countries, and every year we calculate the cancer burden per country, per cancer type, etc. So you can monitor what's going on, and you know what's improving, and you also know what needs attention. So this is our European Cancer Information System, where we really, have an overview of the cancer burden in Europe. Then we also go a little bit deeper, and we host the European Cancer Inequalities Registry. And there really we analyze all types of cancer-related data. So it's not only about burden, but it's also about risk factors, for example. And there, what we really try to do is looking into population groups. And this can be, the usual suspects, right? Age groups, gender, by country, of course, but also we try to look at socioeconomic status, employment, people with or without disabilities. So the idea is really to look for the most vulnerable groups in the population, understand why they don't fare so well with these cancer-related indicators, and really elevate those that are at the lower end so that you can somehow better the whole EU average. So with this data, then you can guide interventions, you can guide investments to these target groups, and really try to raise the level. So these are, for example, some of the areas that we work on data-related aspects. Then, still related to data, we know that around 40% of cancer cases are preventable. So if you think about these numbers for a while, it would mean that like half a million people in the EU could still be alive every year if we would really be able to prevent 40% of the cancers that now happen. And also like all the money we would save in not treating I don't know how many other millions. So what we need and where we try to work on is then on these policies that promote prevention of cancer, but actually because the risk factors are common to cardiovascular disease or to diabetes. When you work on one, you're actually working on many. So the whole idea is really to have policies that promote prevention, that promote health somehow, that facilitate healthy behaviors, so that facilitate easy access to healthy foods, that facilitate physical activity. I mean, like if you think about you living in an environment where there's hardly any sidewalks or public transportation and so on, there's no incentive for you to, for example, walk, right? You would, if you can, take the car. So there's a lot of things actually that you can do on your environment, and not only your physical environment, but on the environment as a whole, that can promote health, and that's where we try to work. So one area is, of course, cancer screening. We have a big team in my unit that works on generating European cancer guidelines, so guidelines for cancer screening and for diagnosis. For example, if you think about breast cancer, it would be things like from which age should you start screening, how often should you start screening, with which type of um, screening technologies, how should you invite the women in a manner that facilitates them coming to the screening appointments, etc. So we have these guidelines for screening and diagnosis, and then we also develop a quality assurance scheme that, in the case of breast cancer, for example, breast cancer units can implement to guarantee like essential levels of care for women, and that's really related to not only diagnosis, but then of course also treatment and follow up, eventually also palliative care. So that we're doing for breast, but the idea is, and we are working already also on colorectal and cervical cancer, and we're also starting to work on lung, prostate, and gastric cancer. So these are the 6 cancer types that where we're promoting population-based screening. What else? I mean, we also work on, for example, on the food offer. So also there are things that you can do to facilitate access to healthy foods. For example, in terms of public procurement of food. So in public institutions that you would only serve or that you would favor serving, more fruits, more vegetables, and avoid, for example, foods that are very high in fat or salt or sugar and so on. We've also worked on labeling, so labeling of foods and facilitating the understanding of the food composition and their healthiness, like their nutritious quality. So yeah, these are just some examples of our work that relate to prevention as well. We also, and it's an area that I don't want to leave behind, is we also do work on rare diseases, not directly, but what we do is we have an effort through our European Rare Diseases platform, where we try to bring together all rare disease registries in the EU into this platform, so that you have enough critical mass and enough data volume to act on these diseases. So if you think that there are maybe 6,000, 7,000 rare diseases, and although, in total in the EU, we're probably around 30 million people living with a rare disease, it can happen that in a country, you only have 1 or 2 people with this rare disease. That's why it's rare, right? So that's really not much. I mean, it's not much for the doctors to learn about their experiences, but it's also not much to do research and understand more about the diseases themselves. But if you think that we are 27, and if there are 2 people in every 27 country bringing all this together, you already have 54 people that you can, learn with, more than learn from. So that's the idea, is really to try to bring together data and the access to the knowledge on these diseases.
Cool. That's fascinating. So, and what impact do you hope these projects will have on public health in the long term?
So, I mean, we're seeing this impact already, no? So, in terms, for example, if you think about the data, it's things that we use for monitoring policies. Like, if giving you the example of the inequalities work, it's something where the data has shown very clearly already for many years. I mean, it's not necessarily work from the unit now, that there are big differences in different countries related to breast cancer mortality or survival and access to screening, for example. So knowing these and knowing about these inequalities, we started our work on the breast cancer guidelines and the quality assurance scheme, so that we could, as I said before, really have, access to essential levels of care in all the EU. And we see, that the countries are implementing our guidance. For example, like I told you before, in terms of age and frequency of screening and so on. And of course, like in the long run, what we want to see is that mortality is decreasing, that survival is increasing, and so on. And that's also what you can already observe with some studies. So we know that screening saves lives, and we are confident that these results will always improve.
Of course, we hope so. And as someone who bridges science and policy, how do you ensure that scientific research informs effective policy decisions?
For us, it's rather simple, because we work hand in hand with our colleagues in the Commission that are responsible for the policy files. So we can propose some research, but the work program and what we do is always something that is thought of in terms of policy needs. We define our work program, for example, together with other services as well, so that we know that what we're doing is useful to the files that are being worked on. So either they come to us for support, or we go to them when we think that there's something that needs the attention of the colleagues working on a particular file. But that's how it works inside the Commission. And then with the national governments, there's also lots of expert groups and high-level groups and so on that we work with, where there are representatives from every member state. So we have like a direct channel, not only to channel our research, but also to understand the needs of these stakeholders, and to ensure that what we're doing is fit for purpose and useful.
And could you share with us an example of a recent policy that has been shaped by scientific insights from your team?
Well, I told you about, for example, the cancer screening guidelines and how they're being implemented in countries throughout Europe. But one example that is maybe a little bit older, but that I find that always resonates a lot with people and sparks a lot of interest, is the work that we did to support the legislation to limit the use of industrial trans fatty acids in foods. So I don't know how much our listeners know about trans fatty acids, so I'll just say it very quickly. These industrial trans fatty acids, and actually trans fats in general, they are associated with heart disease. They can occur naturally in foods, but they can also be added. And they were added at one point. They became a very popular ingredient in many processed foods. Once these heart effects became obvious, some national legislators started taking action, and also food companies started discontinuing their use. But there were still products with trans fats in the market. So our first analysis was really looking into whether in the EU market there was still, and in the EU population, there was still a problem with exposure to these industrial trans fatty acids. And we came to the conclusion that yes, there were still some vulnerable populations that could be at risk of, being exposed to potentially harmful levels of these fats. And then we went through that process that I explained you last week of the impact assessment. So thinking of if we have to reduce or eliminate these industrial trans fatty acids from our food offer, what is the best way to reduce the exposure? Is it labeling these trans fatty acids? Is it banning them entirely? Is it seeking voluntary agreements with the food industry so they can be reduced? So we made all these analyses and tried to understand the impact of each one of these policy options and on health of the population, on economic factors, and so on. And we came to the conclusion that, the most favorable option was to limit their use. And indeed, I think from 2019, the legislation was set in place. And we don't have today these trans fatty acids in foods in Europe.
Yeah, that's one of the examples of what kind of work that you do. So looking ahead, what do you see as the biggest challenge and opportunities in disease prevention, particularly from a policy-making perspective?
So prevention is, a huge opportunity per se, right? Because there's so many diseases that can be prevented, also because the risk factors are common to many diseases. So if we get it right, we can actually, unlock a big health spectrum there. And we've been capitalizing on this, of course. I don't want to say that we have not been improving. I mean, it's enough to think about the life expectancy some decades and now. Of course, we've been improving quite a lot. But I also feel that we can do much more. And I think there are two major challenges that really don't allow us to work so much on prevention policies somehow. And one is that the return on investment on prevention actions comes actually very late. So, things happen now, but you will only see the benefit in terms of the health of the population and in terms of the economy and so on in 10, 20 years' time sometimes, right? And not all governments are willing to prioritize these policies that sometimes are not even that popular. When their success is only measured when they are no longer in charge, right? So that's one aspect. And then, there's also many competing interests in many areas of prevention. I'm thinking about areas like tobacco and alcohol consumption, food-related policies, and so on. There are many interests around these areas. So it's not always easy to support for governments also to support and enact these policies.
Okay. That's a good perspective. Yes. And so thank you, Sandra. We unfortunately have to wrap up our episode. Thank you so much for sharing your insights on disease prevention and public health policy. It's been wonderful to hear about the important work that you and your team are doing. Thank you to our listeners for tuning in to today's episode. If you missed our conversation from last week, be sure to check it out to learn more about Sandra's career trajectory and her inspiring journey in science. We'll be back soon with more stories from extraordinary women making an impact in science. Until then, stay curious, stay inspired, and remember your power to make a positive change in the world. See you next time.
Wow, thank you to you.